Welcome to the Tennessee Heart Health Network webinar. Our aim is to be your resource for innovative statewide initiatives to improve primary care for all Tennesseans. We hope that you enjoy today's educational program and share it with your colleagues to make a better impact of heart health in Tennessee.
Thank you so much to our guest speakers. We have today Jessica Johnson, and she is the Director of Community Research and Engagement at the National Eczema Association. In this role, she leads the strategic development, growth, and implementation of NIA's survey research and real-world data activities and NIA's Ambassador Program, connecting over 500 patient and caregiver members across the U.S. to opportunities to share their valuable lived experience with researchers, biopharmaceutical companies, legislators, policymakers, and others in the community. Johnson holds a master's in public health degree from SUNY Upstate Medical University and Syracuse University, and brings over 12 years of experience in the science and practice of community-based participatory research and patient-centered outcomes research. Isabelle Thibau is the Director of EczemaWise Growth and Implementation at the National Eczema Association, and she provides strategic and programmatic stewardship for the NIA's EczemaWise app to enhance eczema patient caregiver health-wise provider knowledge and shared decision-making through patient-reported disease and survey information, as well as advance EczemaWise as a patient-centric real-world data registry. Isabelle received her master's in public health degree from the University of California, Berkeley, and brings over 10 years of experience in human-centered design for public health research. We are so excited to have our guest speakers here. I do have a personal connection to NIA through my daughter. Has eczema, and I've worked with NIA as well. I was really interested in the approach that they use at NIA to have patient-centered research, and I thought we could use a lot of their knowledge and learn from them as we try to center all of our research at the Tennessee Population Health Consortium and Heart Health Network to engage all of our research and be led from a patient-centered approach. So with that, I will hand over the presentation to our guest speakers. Thank you so much for being here.
Well, thank you and the Tennessee Population Health Consortium for inviting us to speak here today. We are honored to talk about something that we are both extremely passionate about. So we'll be talking about community engaged research. So for those of you who are not familiar, we are the National Eczema Association. We are a nonprofit patient advocacy organization dedicated to supporting the lives of those affected by eczema and supporting advances in eczema research and treatment. If you aren't as familiar with the condition, eczema is an umbrella term for a larger group of inflammatory skin conditions that can cause itchiness, dry skin, rashes, scaly patches, blisters, and skin infections. And the most common form of eczema is atopic dermatitis. More than 31 million Americans have some form of eczema that usually begins at some point during their childhood. In the last decade or so, we have actually seen a pretty dramatic increase in the number of research studies and treatments that have been approved by the FDA for those with eczema. And there continues to be a need to be able to understand the lived experience of our patients and their unmet needs as this landscape continues to change. And then I wanted to mention, not only is NIA the largest private nonprofit funder of eczema research, we also conduct our own research in-house to be able to understand even more the lived experience of eczema. So our goal today is to highlight how NIA involves patients in the research process and other programs and strategies to improve outcomes and care for the eczema community. By the end of the session today, you will learn the benefits of including the patient voice in research, gain a better understanding of the ways in which you can integrate the patient voice into your research, and also learn about NIA programs that enhance patient partnership in research. All right, so why is it so important to engage patients in your research? Well, patients play a key role in driving meaningful research outcomes when they are involved more so than just as research participants. We do recognize that patients are the experts in their condition, and they have valuable perspectives to share based on their unique lived experiences. There are many benefits to including patients in research, as you can see here on the screen. But involving patients and caregivers in your research strategy process really ensures that the research that you're conducting is aligning with the needs and priorities of your community being studied. Having a topic be of interest and of importance to the community naturally is going to improve the relevance and uptake of your research results. Patient engagement and research also increases the ability to recruit and retain participants, which we know can be a challenge in a lot of our research studies, and also just helps enhance your data collection and then again, the relevance of your study outcomes as well. There are implications of not including the patient voice in research. Not including the patient lived experience can mean that findings may not be relevant to the population that you're studying, and therefore treatment solutions may not be sustainable. A lack of consultation of the community you are studying. So in most of your cases here today, those with cardiovascular disease and unsustainable solutions may also end up decreasing the desire for members of that community to want to participate in future research studies. Secondly, researchers and clinicians are naturally at a disadvantage for representing the patient perspective in their research due to their training. So again, the patient perspective really must originate from the experience of one's own personal health journey, because obtaining the patient perspective directly from patients also helps to reduce that power asymmetry that can sometimes exist between the patients and the researchers. We here at the National Eczema Association, and as well as other organizations such as the Patient-Centered Outcomes Research Institute, are working to make sure that patient engagement in research means that scientists don't conduct research on or about patients, but rather they partner with them. So I thought it would be important to share NIA's research philosophy which supports the nothing about me without me sentiment. So as a part of our research program at NIA, we intentionally leverage the patient voice to be able to capture the lived experiences so that our research is ultimately more connected to the things that really matter to the eczema community. This ties back to our strategic blueprint, which guides our organization, that decisions made on behalf of the patient community should be patient-centered. And you can see here some examples of doing this are involving patients from the very beginning of your research process. So when you're even thinking about what topic you want to study, having patients at the table, having those conversations about what is important to them and identifying those unmet needs. Naturally, this will lead to advocacy for research topics, again, that matter most to the community that you're studying. And I just wanted to highlight here the importance of also disseminating those research results back to the community, which I'll talk about here in a minute. All right, so now that we have reviewed why meaningful involvement of patients, caregivers, and other stakeholders is so important in the research process, you may be wondering how to get started. So it is important to recognize that engagement often occurs along a larger continuum. So for maximal benefit, stakeholder input should be incorporated, as I mentioned, from the earliest possible stages of the research process. So I'm going to discuss how researchers and patients can effectively work together to be able to enhance that patient-centeredness in research, and also review some actionable next steps you can take in your research to help incorporate the patient voice throughout that process. So I'm going to walk you through the life cycle of a research initiative at NIA and the places where we engage patients and caregivers along the way at various different touch points. So as I mentioned, when you're first thinking about the research topic that you want to study, having patients at the table for that conversation is extremely important. So for us at NIA, we listen to our community. So whether that be through conducting focus groups, research concept testing at our Eczema Expo each summer. So that's a conference that we have where there's a multitude of patients and caregivers with eczema, healthcare providers. We may hold a session, a listening session to our community to find out what topics are most important to them. Then as we are designing the survey instrument, we also work with our community on pilot testing the survey to make sure that we're asking questions in the most effective way that our community understands and that really represents the needs and the desires of the community. We also involve the patients and caregivers in development of our IRB materials, more specifically in regards to the recruitment language that we will use to recruit participants into our research. So I want to talk a little bit about this next step. So after you collect your data and you are in the analysis process and you're thinking about, what are the next steps? How do I interpret this data? It is going to be extremely important to include patients in this step. And I think sometimes as researchers, we tend to forget that our patients and our caregivers and other stakeholders can be involved in this step. So research findings can really be better translated into applicable solutions when we involve patient partners in this data analysis process. And now this step usually is more unlikely familiar to patients. So there's different ways that you can help them participate in this process. So you can help familiarize them with project-specific terminology. You can share some preliminary findings with patients in accessible formats that would help them encourage questions and revisions. And then also a really important step is during this process, actually observing your patient reactions to the data and asking them what information do they think is most important to share with the community and how they would go about sharing that information. The next step is when you're writing up your research findings. This is also a great way to partner with patients as co-authors of the manuscripts. And if they were involved in that previous step of data interpretation, this is a really nice next step for them to participate, leading towards the dissemination of the research results. All right, so the next step is to actively disseminate your research. And it is so important to engage patient stakeholders in the dissemination of your research findings. Disseminating the results to the target audiences or the communities that you're studying really helps to reduce that gap between research practice and really helps empower that translational research process, actually allowing change to happen from your research data. So stakeholders there can be a lot of benefits to involving your stakeholders in the dissemination process. So they can actually help you as a researcher determine which information would be most beneficial to share with the community and the stakeholder group at large and why. They can also partner with us as researchers to determine the best ways for that information to reach those audiences. So in what formats and what channels do we want to share our study results? And then they can also help identify who needs to get that information the most and how to present the outcomes in a way that all stakeholders will not only be able to access them, but they will also be able to easily understand the data. And lastly, it's important to evaluate your research and continuously keep that continuous feedback loop open with your stakeholders to continue discussions on the research and next steps for future research. All right, I want to highlight a few different programs and strategies NIA takes outside of our specific research studies to promote patient-centered research. One of those is our ambassador program, which is made up of over 500 patient and caregiver volunteers with eczema who really help drive meaningful change by sharing their experiences and perspectives across the spectrum with either key decision makers, so legislators, researchers, healthcare professionals, and the general public. So they participate in advocacy, research, outreach, and fundraising efforts, and really work to improve the quality of life for the eczema community as a whole. They help influence decisions that lead to more effective, accessible, and personalized care, research, and treatment outcomes. We also have a patient and caregiver research advisory council, which provides expertise from both the patient and the caregiver eczema lived experience. And this group really helps inform the research that we conduct at NIA. So this group specifically serves as sort of that bridge between NIA's research team and the eczema community. And we formed this group in recognition, again, that patients and families are such an essential resource to us at the National Eczema Association and will really help represent the interests and perspectives of the eczema community in the work that we're doing at NIA. Just wanted to highlight this group has helped us in a lot of ways. Some specific examples are that they have helped inform some of our data governance practices for our EczemaWise app, which Isabelle will talk about here shortly. They have helped inform research priority areas and various dissemination channels and accessibility for the dissemination of our research. And lastly, before I turn it over to my colleague, Isabelle, I wanted to mention one other opportunity that could be a really great way for all of you to get more involved in patient-centered research, and that is through funding through the Patient-Centered Outcomes Research Institute, or PCORI. So for those of you who may not be as familiar with PCORI, they are the leading funder of patient-centered comparative clinical effectiveness research in the United States. And they really take a unique approach in the research landscape because they really focus on that unwavering focus on outcomes that matter most to patients. And they're really recognized as a leader in the US driving clinical research to become more patient-centered. So this is a really great funding opportunity for you if you're looking to engage patients in your research. NIA did receive a PCORI Engagement Award last year entitled Paving the Way Towards Meaningful Partnerships, Fostering Regional Patient-Centered Outcomes Research to Enhance Eczema Outcomes. And this project really builds the capacity of both patients and research stakeholders to be able to come together as equal partners in the research process. And we do this through a multi-stakeholder research team, as you can see here in the diagram on the slide. A three-way partnership approach and participation of all patients, caregivers, and researchers throughout this project really underpins all of our project deliverables throughout the entire project. Again, from the conception and the design of the study all the way through the dissemination of our results that will happen at the end of this year. Now I'm going to turn it over to my colleague, Isabelle.
Thank you, Jessica. Okay. I'll give just another example of how we have engaged patients and caregivers in research, and that is with NIA's app, EczemaWise. So developed with input from patients, caregivers, healthcare providers, and healthcare professionals, EczemaWise is a self-monitoring tool that allows individuals to track their eczema symptoms, treatments, and triggers, take validated assessments, help patients learn about their own eczema patterns and available treatments, and it facilitates appointment preparation in order for patients to feel better prepared to have care conversations. And EczemaWise is also a health registry. So we're using the data we collect from patient-reported outcomes and in-app behavior to better understand that lived experience of eczema and ultimately further advance eczema research. Now we've engaged patients and caregiver the caregiver community along the way in various aspects of the research process. For example, patients and caregivers were part of the group of advisors from the very beginning, along with those healthcare providers, to help us understand what is important for patients to track and include as part of a self-monitoring tool from the perspective of patients and caregivers themselves. Additionally, the enhancements we make to the app are driven by user need and user experience that are solicited via regular feedback, focus groups, and interviews. Some specific examples include bringing to the forefront just one score to indicate overall severity, which this score existed already as a composite severity score from a validated tool, but making it easier to see as one score and the ability to track it over time was something patients said that would be more helpful to them. Another example is having a quick and easy way to indicate each day whether you're having a good day or bad day without having to fill in a multi-question assessment for that one severity score. So we recently created a flare tracker, which is just a yes or no tracker, but this really makes it easy and less daunting for patients to go in and track things in the app, which is good for patients, is good for providers, it's good for increasing the health data points in our research registry as well. And finally, as mentioned, the Patient and Caregiver Research Advisory Group, or PCRAC, has discussions on key research strategies that directly affect EczemaWise. For example, we've discussed recruitment and what we can do to bring more people from more backgrounds into our research. We discussed research dissemination and data governance, such as patient and caregiver perspectives on our privacy policy and messaging around EczemaWise as a research registry. So not only are patients and caregivers participants in the EczemaWise registry, they're also engaged in steps along the way as part of the research process. It's definitely been a learning experience for us along the way. We want to share some best practices that we have recognized are important to successful patient engagement and that we strive for. One is facilitate ongoing dialogue between the patient and scientific community. And that includes also being open to hearing things other than what you want to or expect to hear. And then handling the information received respectfully and empathetically helps with that ongoing dialogue. Another is ensure you have the organizational resources needed for meaningful patient engagement. It does take a bit of infrastructure and dedicated time to support and nurture these engagements, as well as monetary resources to compensate your patient experts appropriately. Striving for transparency in the engagement process is another important good practice. And set clear goals and expectations for engagement so that the scope and commitment are clear from the start. This best practice of transparency in the process also includes ensuring transparency in research findings and patient outcomes. The more you're able to demonstrate tangible impacts of patient engagement on the study outcomes, the better. For example, with our PCRAC, we dedicated most of the final term meeting to presenting the tangible outcomes within NIA's research processes that resulted from the research discussions and how that would or did impact our specific study outcomes as well. A fourth is create platforms for shared learning and trust building. Support two-way communication and practice a culture of mutual respect and mutual learning. Finally, we find it important to offer educational opportunities for patients to understand the research process. This may not come naturally to them, and engaging in research can be intimidating. Helping them to learn about the research process and how the patient perspective is important at all stages can build confidence to engage. Our ambassadors program, for example, starts patients and caregivers out by requiring them to complete initial learning modules around research, advocacy, and community engagement, which we believe really helps set them up to engage effectively and with confidence, and which we believe in turn contributes to long-term commitment. So now when it comes to recruitment, here are some things we have learned. We have access to a large community through our far-reaching mailing list subscribers and social media presence, but this community ranges from very engaged at NIA to not very engaged at all. We do make an effort to reach new patients and caregivers, so those who are not familiar with our organization, because we know how important it is to have all voices of eczema represented, not just those we happen to reach already. So some of the things we do include ads. Those can be expensive, but they do effectively reach new audiences. And another thing we leverage is our EczemaWise app. It's an important source of new patients and caregiver audiences to NIA. So we leverage that to bring research engagement opportunities to them through the surveys tab of the app or via direct targeting of the emails in our database. It's important when recruiting patients and caregivers for engagement that consideration is given for their expertise as an individual and also their ability to think about others in their community and represent those others as well. And it's important to consider their characteristics, so not just demographics, but also experience with this disease and how that will round out the group of patients or caregivers you're recruiting. So some of the questions we ask during recruitment for engagement activities may include, how long have you been living with eczema? Or how long ago were you diagnosed? What's your severity? How would you rate yourself on this disease control scale? What treatments have you tried, etc.? It also goes without saying that you should consider willingness and ability to contribute consistently and over time. So their commitment to engagement, as well as what potential barriers there could be to engaging. Acknowledging your limitations with the group and help those who are part of your group understand the intentionality behind your recruitment. This can really help greatly with buy-in and commitment from your patient and caregiver group. So it's important to also compensate community members for their time and expertise. The National Health Council has a fair market value calculator as part of their patient compensation tools. That's a good resource. I can see about trying to link that in the chat. And at NIA, we are currently evaluating all the ways in which we compensate community members for different activities in order to be more uniform even within our organization. But in general, when calculating the honorarium, we take into account the expertise that they're contributing, the time commitment, and the complexity of the activity. There are, of course, challenges and opportunities we faced while building and implementing our patient engagement initiatives. And some of those I've already mentioned in passing. So I'd just like to summarize those with you in hopes that we can learn from each other from our experiences. Some of the challenges include ensuring diverse patient representation, and in particular, patients and caregivers that reflect those living with the disease. Another challenge is addressing barriers to participation. So, for example, geographic, financial, maybe the health literacy or neurodiversity considerations of your group and your community. And then balancing patient expectations with scientific rigor. So this is where clarity and transparency really come into play. Opportunities include expanding engagement through digital tools. So for example, at NIA, we leverage EczemaWise to expand our engagement pool by having a whole other community of patient and caregivers to recruit from. And EczemaWise itself has the infrastructure to serve as a platform for patient engagement. Also creating patient networks and advisory groups, such as what we have with the NIA ambassadors and the Patient and Caregiver Research Advisory Council, where patients and caregivers are already onboarded and initiated to engage in research opportunities, where you now simply have to bring the engagement opportunities to them and no initiation each time is needed because that relationship is already there and the initial education part is already done. And fostering collaboration with industry partners to scale patient-centered approaches, such as what we have with our PCORI Engagement Award, where PCORI funded us to build that capacity of both patient and research stakeholders as equal partners in the research process. So now I'd like to take a moment to summarize what we've talked about today. NIA integrates the eczema patient community into our research efforts in many different ways and at different time points in the process, from beginning, from the conception to study design to dissemination of the results and the impact. The collaboration between patients, researchers, and advocacy organizations to advance eczema care is so important and takes us much further than if we were to do this alone. And yes, it may be difficult to engage patients for many reasons, but doing so enhances our work and outcomes in so many ways. In other words, the return on investment is huge. To maintain buy-in from our community, we have found it important to continually explain to the community why patient engagement is needed and why their voice matters. And keeping up this line of communication with your community members can really help strengthen their trust in you and their willingness to engage in your research initiatives if they feel like they're being valued and making a difference. So I want to end with some feedback that we've received on what it means for the patients and caregivers themselves to be engaged in the research process at NIA. So overall, it's been an amazing experience. I felt heard and validated for the first time in our family's eczema journey. I cannot express how empowering this has been. I feel better informed to make decisions and more confident having conversations with healthcare providers. Another individual said, I loved the sense of community and learning from others. And finally, someone else said, it's been a privilege to be part of a group that bridges the gap between researchers and the eczema community. Seeing our contributions was rewarding. It's amazing to witness how our collective work has influenced NIA's initiatives. Being part of this group means a lot to me. So we encourage further support for and participation from the patient community in your own research initiatives. And I'd now like to welcome any questions and discussion. And also, I do want to note you have our contact information here on the last slide, so feel free to reach out to us at any point.
Thank you so much for that presentation. I had a lot of thoughts coming out, and for some of you who maybe joined after we got started, I have been part of the NIA community through a personal connection due to my daughter having severe eczema, and so I have gotten opportunity to work with both Isabelle and Jessica and a few others. And so when you were going through your slides, I had some thoughts. One on your dissemination slide, when you were talking about involving patients as authors. And I thought on a paper I worked with with a few other researchers. So we had a data set that we were working on, and it was about the mental health impacts of eczema severity on the caregiver. So, but then when I started reading, they're asking for feedback, and this is not unsurprising. And like for everybody on the call, we had more female participants as caregivers than we did male. But the way it was written in the discussion part, basically what was coming out of it was the higher the severity of eczema, and the more you see depression and anxiety, that kind of stuff in the caregiver. But like what's coming up to me as a caregiver, I was like, it sounds like it's always mom's fault. It sounds like why are we not getting more dads, number one? And why does it seem like that like a doctor potentially could read this, like they're going to get a soundbite out of it, and that's going to inform their language. Why they're going to say, like, if mom has a lot of depression or anxiety, then potentially that could make their eczema worse. So like, how could we rephrase that? And that was some of the feedback. And we did, we did rephrase that. But I don't think if I didn't have a child or I wasn't a caregiver and have experience like some of those mental health things, like how frustrating it is to have a child with that severity of eczema, I never would have thought that in writing that paper, because it's just objective data that was in there. But anyway, that's an example of involving the caregivers in writing that up. But I see we've got, let's see, Richard Chapman. Any advice on extending this to other diseases, especially rare, and what considerations might need to change?
So thank you for that question. I think that's a great point that I- I'm assuming that for especially with rare diseases, maybe specifically the issue here is that the resources there might not be the resources of organization that maybe deals with a less rare disease, or the access to your patient group, patient and caregivers in your community. But I do think that many of these best practices and opportunities remain the same. I do think that probably, as you can imagine, special consideration and effort may be needed to recruit those patients and caregivers from your community, but it may all depend. I can imagine that the rare disease community is um, very willing and motivated to engage in research, just because there may not be the same kind of funding and attention paid to this community. So, I mean, that's what I would probably say is the main difference and where you'll see your main challenges. But otherwise, I'd say the best practices remain the same. But I would, if anyone else wants to jump in, Jessica, if you have a different thought about that.
Nope, I agree.
We have anybody else who has questions or discussions? I did want to ask, while you all may be thinking, feel free to put it in the chat or to come off of mute. How do you all work with your marketing and communications to get your message out, not only about the research that you've conducted, but also about maybe recruitment or kind of telling the story so that people are interested in the first place?
I can give a quick overview. So we work very closely with our marketing and communications team, because we really do rely on them to get the message out, whether it's recruitment or dissemination, or making sure that our community is aware of any efforts, that patient-centered efforts that we're doing. So yes, it is important to work pretty hand in hand to have them review our communications material, make sure that from their point of view, it makes sense from the layperson. They've been very helpful there to help reframe some of our content. But I think Jessica can tell you a little more about our dissemination efforts, which really we've tried to drill it down to a science, actually, on how to get information out to our community. Of course, she has mentioned that patients and caregivers have been involved in that process. So, Jessica, I'd love to have you speak a little more.
Yeah, of course. So our primary role on the research team is to, of course, conduct the research and then write up sort of like the science from the research data. And then we pass that along to our marketing team. Usually it's not just a handoff, it's a conversation, so that we're sort of able to explain the bigger picture of like how we came upon these results, what it really means for the community. Then they take that language and help us frame it in those various formats that we talked about, which are informed by our community and the best ways for them to receive the information. So depending on the study and the target audience, that might be an infographic, that might be a research report. Of course, we publish all of our work into scientific journals, although that doesn't tend to be as patient and stakeholder friendly unless you're in academia or research, or you're a clinician already. We've done podcasts and webinars to communicate our findings. We have been talking with our patient groups about potentially figuring out how to disseminate some of our research into various parent groups and mom groups, because that seems to be an area where a lot of questions are arising on topics that we have more research on that isn't getting to those specific communities. Ethnic media is a really great way to share your research as well. So through those channels, And again, it's really just based off of what we're finding in our research, but then again, what we are hearing from our community and what ways they want to receive that information. Because again, we don't want to do our research in a silo. We want to make sure that we're able to disseminate the research in a way that's accessible and understandable to the larger community.
What are the best ways to since you have so much of the community with the patient voice, what is the best way to disseminate that information to clinicians to have them hear that? And because that's something that we do, especially at our annual meeting, and we get a lot of positive feedback, is our patient panels. But if there's anything else where that you all have ideas about to make sure that patients and kind of like citizens of where we're serving are really heard.
We do that in a variety of ways. One example is just our presence at the scientific conferences, in the clinical meetings that we attend. So we'll give talks, we'll moderate patient panels, which is a really great way. So we might give a research presentation and then we'll moderate a patient panel so that patients and caregivers are able to speak to the topic that was studied. And that's a really unique opportunity. Not a lot of our researchers and clinicians don't always have that opportunity to hear directly from the patients, especially surrounding specific research data. So that's another way.
I might say that we also try to get into the healthcare provider media landscape. So, helping to co-write articles, like magazine articles, that sort of thing, is another way to get in front of them with the work that we're doing. And continuing medical education also. We try to provide different opportunities there where we can specifically cite our findings.
Yeah, I agree. And I think so we have our different tracks that we do for education, and our patients are very interested in hearing all of them. And so I feel like the ones that have presented to clinicians or to our larger groups are very engaged. But every time we have the patients present, I feel like we still are learning a lot. We're like, whoa, I didn't know that. I didn't know that. There's always something that adds to the discussion with a group of clinicians. So I think it's a great opportunity.
I wonder if we can ask some questions for our audience. I'm curious to know if there are any specific challenges that anyone here has faced in their efforts for patient engagement, and we'd love to hear that, and maybe what kind of things you've done to overcome those challenges or to deal with that.
I joined very late, so I missed probably the best part of this. But we work in the diabetes and cardiovascular space and with the Tennessee Department of Health, and we're always trying to promote evidence-based lifestyle change programs. And I think that we've struggled with, sending out really text-heavy information in a written format. So one thing I think we have tried to keep an eye out for more is just promotional materials that are in video format. And we're not in a place to make that ourselves. And this may be different than what your conversation today was even really focused on. But we've tried to just look for existing promotional materials from those like CDC programs. It's just really hard when you give someone a pamphlet with lots of text on it. They may get it on their way out of a doctor's office and they've just been bombarded with information. So that's where we're trying to head.
Thank you for sharing that. Yeah. We also get that there's burden in trying to even just read through what the engagement's about, what the research is about. And yeah, I think there's a big attraction for video format or or as we mentioned, podcast format. That's another way that we try to get information out. But people these days are bombarded by a lot of information, and so getting their attention is a challenge.
Infographics, I know it's not the same as video content, but that's a really great way to get out your information, where there's fewer words and more pictures and just really highlighting, the main messaging. So that's been successful for us. And also this is, more along the lines of the video content, but YouTube we found is a huge place now where people are engaging. So I know a lot of people are now moving towards doing more YouTube shorts to convey their information. So that's a direction that we're leaning more into this next year as well.
We have constraints over what we can share as far as pictures and things like that. And so if you go through a lot of the pictures, a lot of things that are easy or that you don't need clearance to share or releases are people that either work for us or that are public figures. Those aren't really patients, but to me, it can, after we finish an event where we have the patients and that was the focus, to me, then if we post those pictures, then it looks like, okay, we've got somebody with a big name and awards, and that wasn't really, it just seems intimidating versus approachable. Academia ivory tower versus we're here to help you. And that's not what our mission is. Our mission is to healthy Tennesseans, healthy communities. So, but I understand why we have those constraints. And so I just wish we could communicate that message a little bit easier. Because if I was scrolling through there, I'd be like, well, I'm never going to get that award. I'm never going to get that grant. I don't think those people could help me.
So Ashley, are you saying that you wish that there were more supportive channels where you could show examples of patients engaging in some of these conversations and in some of these meetings through pictures of the events?
Yeah, because our media really is not, there's no intent for it to be for the public. The intent is for it to be for other academicians, it's for other departments, for for us to be ranked and things like that. But that's where we are. That's where we host it. There's things we could put on top of it, but there's so many layers to it. But yeah, I wish that we could make it look like, it does not look like if you go out a block from here, a person would click on it and be like, that's where I need to go to get help. That's where I would go figure out how to overcome getting my medications or getting help with healthy groceries or to find out what diabetes is, go for heart health. It looks like, oh, that's where somebody with a whole bunch of letters after their name works.
So making the information more accessible to the community that needs to be receiving the information.
Yeah.
Who would benefit from that information.
Yeah.
And that's where, it really helps to, again, have those patient and stakeholder partners sitting at the table when you're having conversations about how to communicate different information, how to put it up on your website, what's the best way to communicate that? Because, they would say, this is not friendly to us. This would deter us from, going to the site to get the information. We will just go elsewhere. So again, important to have the patient perspective at the table for all of these communication, design activities as well.
And like I said, it's very similar to what we were talking about with the dissemination. I wouldn't have read that paper that way if I were just the researcher. I'm gonna be like, I'm not saying anything bad about moms, but when you are the mom, you're saying 95% of these moms are sad, and that's why their kids are itchy. They're coming up, if you just kind of reword it a little bit, it's so much more approachable. Because when you go to the doctor, you do feel like it's your fault a lot of the times because you're tired and you're whatever, those kinds of things. And people can read it that way. But anyway, I think all that's really very helpful. Thank you so much for joining us from NIA. We appreciate both of you and the work you do, and anything we can do to make our work more patient focused. Have a great rest of the day, and we'll talk to all of you soon.
We hope that you've enjoyed today's webinar. For more information and resources, please visit our website, tnhearthealth.org. You can find more webinars under our resources page. You can also follow us on Twitter, LinkedIn, and YouTube. Please let us know if there are any specific topics or speakers that you would like us to present. Lastly, tell anyone you know who would be interested in helping to decrease the burden of cardiovascular diseases in Tennessee and share the webinar. Together we can achieve our goals of managing and preventing heart attacks and strokes for Tennesseans.